All right, I think we can probably get started. Hi everyone, I'm Phoebe. I'm one of the product marketers here at Heidi. I'm also a nurse. And again, just so thankful and happy to have you all here today to see Heidi in action and how Heidi helps nurses. I'll share my screen and we'll get started, and then you can meet the rest of the panel members. Just give me one moment. Okay. All right, can everyone see my screen? Give me a thumbs up, Joss or Simon.
Yep,
Yep, excellent. All right, let's get started. Yes, hello and welcome to Heidi for Nurses. I'm super excited to have you all on the call today. We've got a really great agenda to give you a really great look into how Heidi's AI care tool supports nurses in documentation and admin. To get things kicked off, very excited to introduce you to the panel members today. I'll throw over to Simon first.
Hi everyone, I'm Simon. I'm the Global Chief Medical Officer here at Heidi.
Thanks. And as I said, I'm Phoebe. I'm a nurse by background. I have experience in ICU and neuro, and I've been working in health tech for a few years and now at Heidi in the product marketing team. And over to Joss.
Thanks, Phoebe and Simon. Yeah, my name's Joss. I'm a nurse by background as well. Work mainly in cardiothoracics, and I've been in health tech the last 6 years, and very happy to be a product marketer here at Heidi.
Thanks, Joss and Simon. To get us over to our agenda, to kick us off, Simon's going to give us an overview of what it actually means to value clinicians' time, and a quick look into how nurses are currently using Heidi today and the kind of benefits that we're seeing. And then we'll jump straight into the product. So Joss and I have two really excellent demonstrations to walk you through, both in an inpatient and an outpatient setting, and to give you an idea of how nurses can use Heidi today to the best of their benefit. And then at the end, we'll leave some time for some Q&A for a live session with Joss and I. All right, so over to you, Simon.
Thank you, Phoebe. Thanks everyone for joining us for this webinar. You'll see some great things, and we're in really good hands with Phoebe and Joss, who, as mentioned, are nurses and can take you through some structured workflows. I'm not a nurse. I'm not going to pretend I am. My background is critical care medicine, but I was just reflecting on my clinical years and what I learned. In medical school, we learned all about anatomy, physiology, pharmacology, all the rest of it. When I actually started practicing, I learned everything that I practically know from the nurses on the wards. I was lucky enough to have some fantastic mentors, and they teach you the practical things that while the dose of morphine might be 0.1 milligram per kilogram for patients, that doesn't mean that you give a 10 milligram bolus to someone who's in pain. And I'm lucky enough to be married. My partner was a dental nurse for many, many years. She's actually a third year RN at the moment, and she's currently on clinical secondment doing operating theatres at the moment. Going through that degree with her, I feel like at the end of it, I'm going to have an honorary RN, and I've got a new appreciation for the central role that nurses play in care delivery. I have been in digital health for over 2 decades, and I have been excited about it before it was exciting. I must say the last couple of years is the most exciting I've ever seen digital health, and it's because artificial intelligence is here and it's delivering meaningful, practical efficiencies in healthcare globally. And ambient scribing, which we're going to get into detail today, represents just an enormous opportunity to unload some of the administrative burden that clinicians face today, and then free them up to spend more time and focus on patient care. But I did want to acknowledge an uncomfortable reality. Digital health often over-indexes on medical practitioners, and that's due to structural and billing biases. And what that results in is historically an underinvestment in the tools for nurses and allied health. And that's not only not particularly equitable, it's not really smart for modern healthcare, especially when we're here in the era of AI. So I joined Heidi because Microsoft was where I spent the last 15 years. I joined Heidi because this is a movement I absolutely needed to be a part of. It's fantastic to see technology actually delivering meaningful improvements for clinicians in how they deliver care. But there are a few other reasons I joined Heidi. There's an amazing team. You're going to meet two of them here today in Phoebe and Joss, and they're going to take you through. You'll see what the Heidi culture looks and feels like. I knew that ambient scribing was exciting, but I think when we get beyond ambient notes, there's an incredible future in all of the downstream activities when you capture rich information, what you might be able to do with that as a secondary transformation. And there's a whole lot more administrative burden that these technologies can unload. So I got very excited about that. But I also got excited about the philosophy that Heidi was built on. So our founder, Tom Kelly, really wanted to double the world's healthcare capacity by freeing up clinicians of administrative burden. And central to that equity mission is making sure that we get this technology into as many people's hands as possible. So Heidi has both paid and free tiers. What that means is with the free tier is Heidi has gone global, and today we're the most used global scribe. We're in more than 110 countries, we're in 116 languages, there's 200 different specialties. And because we haven't told people how it's meant to be used, we've just made these great tools available. We're learning about how it can help various different specialties, clinicians, and even non-clinicians around the world. So those 200 different specialties, they include nursing, they include allied health, they include, surprise, surprise, it was never made for this, veterinary science. So we've got people treating animals with it, social services, disability support, all of that sort of stuff, which is amazing. And so if we jump to the next slide, I was lucky enough to be in New Zealand for the last couple of weeks. For the last couple of weeks, I've seen how Heidi is being used by nurses. This was in a primary care setting. I also talked to some acute nurses as well. And fantastic to see that, yes, this technology is getting into the hands of nurses. It is making a difference for them. And you can see some important stats there on screen. So of the nurses that are using Heidi, 90%, 98% of them are saving documentation time, and they're saving on average 45 minutes per shift. This is in the disciplines of emergency, mental health, and community nurses, and they're using it for a variety of functions, as you'd expect. Progress notes, care planning, handover summaries, handover and discharge, even multidisciplinary team meetings. There are some differences for the nursing workforce that aren't on this slide that I found. Typically, when you deploy it out to doctors, they use their own personal devices. Nurses like to have fleet-issued devices, we've heard. And unlike the way doctors kind of have brought this technology into the organisation, contrary to organisational policies, nurses do the right thing. They want to have these tools mandated and approved for use in the organisation. And when they're rolled out with clear communication and training, so that everyone can be on board and we don't leave anyone behind. So we're in the early days of understanding how these technologies are going to make a difference into the future. They're here to stay though. So thanks for joining us. And I'm just as keen as you are to learn some more about these structured workflows and the activities of how ambient voice technology makes a difference to nurses. I'll hand back to Phoebe and Joss.
Thank you so much, Simon, for the really interesting insights and sharing all of that amazing knowledge about how nurses are using Heidi today. So,
Phoebe, just
jump in.
before you get into it, we've got a few questions. Just one I'll call out about is the PowerPoint available after this session, which will make sure all the recording and materials are available after this.
Yeah, we'll send out an email with both the YouTube link to the recording and all the material. I'll also just shout out, I forgot to mention at the beginning, there is a Q&A function. So if you have any questions at all during the session, we'll try and answer them live, and you can just pop your answers in. Okay, so before we get into the demos, this is a good segue for you to use that Q&A function. We're really interested to hear how you would get time back in your day had you had Heidi by your side, saving you that 45 minutes. Like, what are the kind of things that you would do in your shift or in your work day to save 45 minutes? It'd give you a few seconds to write and see some ideas. Yeah, I've got some good ones coming in. Take a proper break,
Love that.
catch up on recalls. I remember my biggest one in ICU, because you were stuck to the bed and you couldn't really move, was just like getting water. It was constantly, I was more dehydrated than any of the patients there. Consents for using Heidi. What is required? That's a great question. We'll get to that really soon, Emma. Spend more time with the patients discussing their worries. Absolutely. And that's one of our biggest benefits of Heidi. It gives you that amazing face-to-face time. And instead of looking at your EMR screen or trying to write things down, you're actually there with the patient and really present in the room. So thanks for that one, Dominique. Awesome. All right, so we've got some really good ideas coming through. So it's obvious that Heidi is amazing at giving you back that time in your day. And so very excited, the next slide. So Joss and I are now going to show you actually how Heidi works at giving you that time back and how you can start, really making your work days and shifts more productive. So we're going to step through two scenarios. One will be based on an inpatient ward setting, as I mentioned before, and that'll be like a nursing handover between theatres and ward. And the second will be in the community, so hospital in the home type setting, home visits. We've chosen two fairly different clinical settings just to show you how adaptable and flexible Heidi is across a multitude of different clinical environments and specialties. Like Simon mentioned before, Heidi's really great in a lot of different ward settings, whether it be community, maternity, inpatient, PACU, nurse practitioners and CNCs find it really great for care planning. And then from a documentation perspective, Heidi's really amazing. We've got a really flexible back-end template structure, so you can, produce anything from a handover to a report. And yeah, it's certainly not just limited to handovers, that's for sure. I'll also mention here before we jump in, which we won't be demoing today, but Heidi has incredible integration capacity. So, we're integrated with a whole range of different practice management software systems and EHRs, including Cerner and Epic. And that just makes it really easy for the data and all the information that you produce in Heidi to just map directly back to your patient's chart in that clinical system. So enough from me. I'll hand over to Joss and then we'll get into the demo.
Awesome. Thanks, Phoebe. And just a great comment from Will here, which he's mentioned face-to-face consult are now focused on patients, which is such a great call out. So thanks for that, Will. Great. So let's get into it. I'm going to take you through an example of how to use Heidi for a nurse handover in an inpatient setting, as Phoebe mentioned. So we all know how hectic the environment can be when you're transferring patients or handing them over. And what this really does, Heidi helps you in these moments, is to really pay full attention to the patient, really speaking to Will's comment a moment ago, and enabling you to actually engage with your colleague. So I'll just get you, Phoebe, to swipe over to the Heidi interface. So for those of you that haven't seen Heidi yet and you're new to it, I'll just give you a quick 101 on the download of what the interface does. So you'll see on the left side panel, this is where you can access all your template library, your community templates, settings, integrations that Phoebe mentioned. That's where you can access all of that. The next panel over is all your sessions. So past scheduled sessions, you can view, search, delete, and organize all your sessions there. And then finally, on the far right, the biggest panel that you can see, this is really where all the magic happens. So you can create, edit, finalize your notes and documentation here. And that's where we're really going to talk through today. just to call out, you'll notice there are 3 tabs. So these tabs are always there. So you can see context, transcript, and note. All of those, we'll kind of talk through those as we go through the demo. And finally, you can see those little green bars are magically moving around as I'm talking. So that is telling us that Heidi can hear your audio. And if you select that, you can also choose what your audio input is. Great. So now that we're all familiar with the interface, let's get into the scenario. So just to give you some specifics, so I'm going to be a recovery nurse, handing over to Phoebe, who's a ward nurse, and waiting for a patient to return to the ward after a pacemaker insertion. I haven't done my notes yet, but I don't want to delay transferring the patient. But I also need to get back to the recovery for my next patient quite quickly. So this is a really great example where I can use Heidi during the bedside handover I give. So by the end of my handover, my notes are done already in seconds, which is a big win. So again, it kind of really enables you to focus on the patient and your colleagues and the charts that you're looking at and engage with one another rather than having to spend time focusing on the notes. So imagine I've arrived at the ward. I'm going to open a new session, which is on the top left. So we'll click that. In order to organize my sessions, I like to add patient details. So you can see there in the top left, today we'll be handing over James Roberts. So in there, I'll just put JR. He's a 68-year-old male. So I'll just put JR 68M. Before I start as well, it's really great to know the extent of the languages that we offer at Heidi. So we support over 110 languages. You can select your input languages up to 3, or you can also select auto detect, as well as your output language. So they are the options that you have with the languages. And really important to note, this is not a translation tool, as tempting as may be. It is definitely not for that purpose, and you must speak and understand the language that you're transcribing and producing notes in. Great. So the 3 tabs I mentioned, I'll just give you a quick insight into the context. So basically in this scenario, I want to make sure I don't miss or forget any of the post-op instructions that I've been given from the surgeon during my handover. So in context, this is a really great place for kind of piecing together different fragments of your patient's care. So you can add historic context like medical history, allergies, your handwritten ward round notes that maybe are sitting on paper somewhere that should be in here, and post-op instructions, which is the example we'll use today. Another great call out for this is you can input stuff in here that you may not want to verbalize out loud. So for example, a patient's social history, you can just type straight into context there and add anything in. And then at the bottom, just calling out, you can also upload different documents, whether that's the surgeon's note or referral letter or whatever it may be, you can add that straight in there.
I'm just going to stop you there. Joss got a great question in the chat about the context and the different kinds of things we can upload. They've asked if they can upload PDFs and screenshots, and yes, you can. So basically the attachment lets you upload documents, PDFs. You can even take screenshots of radiology reports or LFTs, and you can just upload it all. The only thing it can't take is complex images, so it's not going to read like an X-ray scan, but it will read the report of that radiology. Thanks, Joss.
Great. Thanks, Phoebe. Awesome. So we've got our post-op plan posted in there. And just to note, this will auto-populate my notes once they're generated. As you can see, it's got instructions on like dressing, arm precautions, anticoagulation, etc. So that's all ready to go. So I'm now ready to give my handover to Phoebe. So we'll click transcribe. So this is the consent pop-up. You have the power to choose whether this pops up or not, or your organization does if you're within an organization. So yeah, this is just a great one to note before you start the consult or session or handover. You just need to select consent. Great. So In terms of,
Sorry, Joss. Another really great question just while we're on this screen for consent, and it comes up quite a lot, is someone is asking if they're getting consent from their patient during a clinic visit. How do you describe Heidi to a lay member of the public or a patient?
yeah. Yeah, so that's a really common one. And I think I'd preface it with the fact that I think we have less than 2% of patients that ever decline using these kinds of tools. What we're hearing is really positive feedback that patients feel like they're actually being seen and looked at, as well as if you're engaging with colleagues and doing like a handover, for example, you can actually just focus on the patient and the handover rather than like trying to sort of madly take notes on the side. So I think that's just an important thing to know. In terms of describing it to patients, so sort of my go-to is just saying it's a live transcription tool that listens to our session. It doesn't record any audio and it's stored securely in whatever system that you may have. So in this case, a hospital system, like all your other information. And yeah, again, I like to say it just helps us better communicate so we can actually look at each other and engage and yeah, without having to look at my computer or notes.
Thanks, Joss. I'll also just mention if you jump over to the Heidi website, we've got some really great resources and patient explainers and FAQs that you can print off and save and hand out to your patients while you're introducing Heidi.
Great. Thanks, Phoebe. Awesome. I can also see we've had a question come through around community work, which is very, yeah, is actually in the next section. So we'll run through that in a moment. So now that we've gathered consent, we will move over to our handover. We'll just do a quick demo so that you guys can see like how it works live. So we'll select consent. And then you can see Heidi started transcribing. So, hey Phoebe, I'm Joss. I'm the recovery nurse handing over James Roberts.
Thanks, Joss. I'm Phoebe. I'm the ward nurse. And I'll be taking handover from you for James.
Awesome. Great. So James is a 68-year-old male. He's just had an elective dual chamber pacemaker insertion with no complications. He's awake, alert, and oriented, as you can see. GCS is 15. He's following commands appropriately, self-ventilating on 2 liters of nasal proms and saturating the high 90s. Post-insertion, he's been cardiovascularly stable, so heart rate in 70s, 80s with paced rhythm on the monitor. Blood pressure's been good, 115 on 70. He's got warm peripheries, good cap refill, and no chest pain or dizziness. And his abdomen, soft, non-distended. He hasn't had anything orally yet and no nausea currently.
Does he have any PRN, antiemetics or ondansetron charted?
Yes, he's got PRN on Dantatron ready to use if he needs it.
Great, thanks.
What else? So he's got an IDC in situ, draining clear yellow urine with good output so far. And he has a left upper chest pacemaker pocket with a dressing in situ as well, that you can see there.
Has there been any swelling or oozing at the site?
No, it's all been clear. So you can see here he's got a clean, dry, intact dressing. We haven't had to change it. And all while we're on that as well, all these pressure areas are checked and intact as well. In terms of drains, he's got no drains. He's just got one cannula in his left forearm where he's got Hartmann's running at maintenance.
When's he going back on his anticoags?
Yeah, good question. So post-op instructions, the surgeon said to restart 24 hours post-op. So if there's no bleeding or hematoma, he can resume those. He's also got TED stockings on for DVT prophylaxis. Great. So yeah, pre-op he was independent, post-op hasn't mobilized yet. So just if you could assist with first mobilization once he's settled and obs are stable, and just make sure to take care of that pacemaker arm, like avoid any strong arm movement. Pain is 3 out of 10, well controlled with analgesia, which we gave to him in recovery. Post-op instructions are to continue post-op obs as per protocol. Maintain our IV fluids and strict fluid balance. He can start sips of water, then light diet is tolerated. And of course, just escalate to cardiology or surgical reg if you have any concerns.
Great. What were the protocols for the obs as per the surgeon's instruction?
Yeah, yep. So they're all noted in here. So every 15 minutes for 1 hour, 30 minutes for 2 hours, then hourly for 4, and 4 hourly if stable.
Great. And any family or visitors?
Yes, good question. He's got wife and son waiting in the cafeteria. So I've let them know that he's doing well. And if you could just give him a call when he's settled and ready for visitors.
Great. Thanks, Joss.
Awesome. We won't bore you with any more of that. So thank you, Phoebe, for riffing with me there. So we've finished our handover. We've clicked stop transcribing. And what you'll have here is the option to select a template. So templates are basically a way to structure your notes exactly the way you want them. So we've just updated our template library. So there are some great ones in there for you to choose from. Today we'll choose the nurse ward handover note.
Before we move on, I'll also just show you. So these are all the templates that I've got saved in my personal library, and you can create whatever you like. But Heidi will also, if you can see this little symbol here, it will recommend other templates for you based on the session. So you can see it's picked up that it's a nursing handover. So it's recommended a handover summary, a post-op note, or a transfer note for James Roberts. But we'll use our custom template today.
Great, thanks, Phoebe. So yeah, once you select the template, it'll take some time just to generate based on the transcript we've just run through. Important to note is Phoebe and I could have spoken for 10 minutes about our gardening, and none of that will populate into the note. It will only take what's relevant, and it doesn't matter which way you say it, it will structure it according to the structure of your template. So you can see here, based on the template that we'd created, we've got our nice note there with all the different insights that we spoke about, and my notes essentially ready to use immediately. And I guess just to call out, there are a couple of ways if I look at that and think maybe I'm not super happy with it. Firstly is looking at the voice. So you can see we've got Goldilocks, which means it's just right or a good balance. You can also choose things like brief, which means it's really quick, concise, stop points. Detailed is going to be a bit more comprehensive and more in-depth. And super detailed is going to have, extensive detail, quotes and so on. Often sort of mental health sessions might use that one. So yeah, that's a quick way to update your notes as well.
I'll also just while we're here, Joss, show what the actual template looks like from the back end. So this is the template that we've used. And as you can see, we've structured it in order of the headings, and then these little placeholders will instruct Heidi what kind of information we want in each section and how we want it written. And then what you get is essentially a note that has implanted all the information from the transcript and the context into that structure.
Great. Thanks, Phoebe. Yeah, and just calling out, we've mentioned templates as being like a really great source to quickly generate a note for you. On the left side, you'll see there's a template library, which is your own templates, but also we've got, and here you can favorite them. And then we've also got this community here where you can filter it by your location, specialty, category. We've had so many wonderful nurses globally contribute to these. And you can also see how many people have used them. So some of them are more popular than others. So you can use that as a source. If say perhaps if you're in an organization, they don't have them. If you're in an organization, they may have them ready for you. But if you're sort of wanting to source your own, you've got this to access as well. Great. So yeah, now I've got my sort of detailed structured notes kind of done in the moment. Didn't have to kind of do anything before or after. So yeah, this has hopefully saved me a lot of time and prevented any delays in transferring patients or me having to stay afterwards to write notes to type notes after my handover.
Thanks, Joss. And I'll also just call out after you've got the note and you're happy with it and you've made any edits, like you can remove sections yourself, or you can also add other sections in. You can free text. You can simply one-click copy and you can paste it anywhere you need in your other external like practice management software systems or EHRs. And you can also send it as an email, print it or export it as a PDF. If your EHR is integrated, you'll be able to push it directly back into the EHR fields that you use. So yeah.
Bear with me, everyone. There's quite a lot of questions coming through, which is awesome. So keep them coming. We'll try our best to answer them. I can just see one about what devices are being used by each nurse during this handover. So I think in this scenario, this is where you'd have your just your general workstation where you're walking around. I've just blanked on that word, Phoebe, in this moment.
We used to call
Workstation on
them,
wheels.
yeah. We used to call them wows and cows back in the day. The portable computers with your
Yeah.
EHRs.
So that's in this scenario what I would have been using.
I've got a good one around patient privacy in a shared space. So, a lot of personal information could be shared out loud in one space regarding multiple patients. So, I guess the use case in this scenario is just a normal bedside handover in a ward setting. And what you would do is you would verbalize those things out loud to your nurse that you're handing to as you usually would. And then any sensitive information, you could just take your portable workstation or your computer, or if you're using the mobile app, away from earshot if you're discussing sensitive information with the nurse.
Great.
All right, so we might jump over to there are some other great questions, but we'll continue to monitor the chat and answer them as we can. But just to jump over to scenario number two. So in this scenario, I'll be a community nurse visiting a patient at home, which I know we've had a few people in the chat interested in to see how this workflow works. And we know that for many nurses that work in the community, it can be pretty chaotic because you're in and out of the car, in and out of patients' homes. So notes can be scattered. And it's also pretty hard to keep up with all the follow-up tasks and your to-do list while you're on the move. So it often means staying back late at the clinic to finish up all those documentation and care plans. So what we're going to do is show you how Heidi can transcribe and produce documents in real time on the go. It'll be able to log follow-up tasks automatically for you based on your consults with your patients. And we'll also show you how to start generating other downstream documentation on top of your notes. So things like more complex documents in patient referrals and patient education summaries.
Maybe there's just a question around using Heidi on their phone, and yeah, how that works in this scenario and if they can do that.
Yeah, that's actually a really great shout. So for today, I'm actually going to be demoing on the web app, but it's likely if I was in the community nursing, I would probably be using my Heidi mobile app. Because what it means is I can transcribe the session and produce the notes right there in the room and not have to like lug my computer around. And then it'll save all into my Heidi account, my session. And then once I'm back at my desk in the clinic or at home, I can then continue to use that information to develop out my clinical notes. All right, so let's jump over back to the Heidi interface. I'll hide these sessions to give us some more space and I'll start a new session. So I'm going to spare your ears having to listen to Joss and I do another fake consultation. And for the purposes of this demo, I'm actually just going to upload an MP3 recording that we took beforehand. So we can move through and you can see some of the features without just in the interest of time. While that's uploading, just for background, in this particular consult, I'm a community diabetes nurse educator. I've been referred to a pediatric patient who has a new diagnosis of type 1 diabetes. His name is Tom. He's 12 years old. The consult is in his home with his mother present, and we're mainly focusing around medication administration, education, different options for insulin injections, diabetes management care planning, and addressing any other kind of anxieties or questions that Tom and his mother have. So I've uploaded the MP3 recording. And the first thing I'm going to do is, as we saw before, you'll be presented with the template prompt. So for this example, I've got a diabetes nurse clinical note saved in my template library. So if I just click that, my first initial note I'll create as it generates. we'll give it some time. But as Joss said before, I absolutely could go into context and add any other information I had on this patient. That could be a referral letter from the GP that I, received the referral from, or it could be any other background around his previous hospital admission when he was first diagnosed or anything like that at all. And then obviously everything, so this is the transcript from my MP3, all of that information will be consolidated and then it will come out in this base note. So as you can see, we've got the clinical progress note, and based on the template that this note's kind of based on, you've got it's inserted my name, my role. It's got the patient's name, the mother who were present, the reason for the session, and you can see his post-hospital discharge on a new diagnosis of type 1 diabetes, and reinforcing the insulin administration and blood glucose monitoring regimes. We go through the assessment that was undertaken during the session and the patient's concerns around returning to football at school, and he's got a phobia of needles. Whole lot of education that was provided and that really nice detail in what was actually like communicated to Tom and his mother. And then also some education to the mother about how to do glucose monitoring, the demonstration that was performed, any family responses and social issues, and then a really nice, concise management plan. So yeah, as we said before, you have total control over how this note looks. You can free text, edit it, and you can also dictate directly into the note as well. If you've got, if you just want to riff off some extra details that you have, all you need to do is align the cursor and just use this smart dictation button here. So the next great thing with Heidi I wanted to show you, which is really cool for community nurses, as we said, who are always on the move, is Heidi's tasks feature. So basically what tasks are is Heidi can turn all of your documentation and management plans into auto-generated to-do lists based on the session information. So what you need to do is just open up this little side panel on the right and you'll see this little checklist that Heidi's generated for me. So as you can see, I have a referral for the glucose monitoring pump and assessment from the endocrinology team, and I've also got to prepare school care plan for Tom. And that was around some of the anxiety that Tom and his mum had where they were, unsure if the school nurse knew how to handle his new diagnosis. So if I'm like still in the house with the patient, still in the session, I can just hover over this to-do list and there's a little icon here called Generate Document, and Heidi will open up a new tab and it will start to actually write my referral letter for the endocrinology team to assess Tom for the CGM. And this isn't based on my own customized template. This is something that Heidi's auto-generated. But if I did want to build a customized referral letter, all I would need to do is create a new document and then jump back into my own template library. But Heidi does an amazing job at generating these letters from scratch. As you can see, it's got everything I would need. I can obviously edit it as I need and actually write the name of the team, but it's got the date, the reason for my referral, the background, medical information for the patient. So yeah, you can edit that and then print, export, or push it back to your AHR. So yeah, task is an amazing thing that we have in Heidi because it doesn't just stop at documentation. It keeps sort of, automating the care plan well after the patient's left. So that whole sort of patient journey. So the other thing I wanted to show you is this little Ask Heidi function down here. So essentially what Ask Heidi is it's kind of like your own personal AI assistant that sits, alongside you, and you can really ask Heidi to do anything from, formatting to new document creation or summarizing any information from your session. For this example, I could ask Heidi to prepare a patient explainer for me. Given that there's so much new information and type 1 diabetes is a pretty complex diagnosis for a 12-year-old, I could just say to Heidi, can you prepare a patient explainer for me that I can give Tom? And then I can also say, make it appropriate for a 12-year-old. So I know it's not going to be using over complex language. So I'll give Heidi a moment to think. What Heidi's doing at the moment is taking all the information in the context transcript and my base note, and it's using all that information to generate that explainer. So here we go. Great. So, hi, Tom. Here's the information to help you understand. And then it goes through everything that we spoke about. It's dealing with needles because we know he's got a bit of a phobia about it. Playing footy. Yes, he can keep playing football. And then, cool tech for diabetes. And that just goes into the CGM and the different insulin pumps that we spoke about. So, this is, it's quite amazing because it's got obviously clinical relevant information, but it's really nicely written for a pediatric patient. So all you need to do is, I'm quite happy with that, is pop down to actions and then create new tab. And Heidi will open up yet another tab. And there is my patient education form. So yeah, I guess just conscious of time. There's so much more to show you with Heidi, and we could keep going, but I'll stop there because I know we've got heaps of questions in the chat, and we do want to leave time at the end for questions. Um,
Phoebe,
we've
I'll
got,
jump in with one here just around templates and whether the diabetes nurse clinical notes is available to others on the community. Um,
um, I don't think it is. I think this is one that I actually built myself, but I'm more than happy to post it on the community after this session, and we'll upload it as a diabetes nurse clinical note.
Great, thanks for that. Got a couple of other questions, probably for the people that are more frequent users of Heidi. So one is just looking at the ICD coding.
Oh
Um,
yeah.
Maybe Phoebe, you're a great one to just speak to that one. And the question is, does Heidi consider terminology that is suitable for ICD coding?
Yeah, that's a great question. And it's something that we're developing every day, and we're making it more accurate and more usable in workflows. But currently, we have quite a lot of different code sets for billing and medical codes. So, based on what region you're in, if you go into your settings, you should be able to see what code, and you can just toggle them on and off. So, assuming we're mostly Australians in the room today, you can see I've got ICD-10 and MBS. So I'll toggle those two on. And then if I go back to my session, and I probably have to refresh this for it to refresh the codes. But you can see these are American codes, but you can see the codes are listed in order of relevance. So the highly relevant ones, what Heidi will do is it will detect the terminology and it will align it to those medical coding items. And then if you keep scrolling, you've got medium relevance and then you've got low relevance. So if I want type 1 diabetes for the ICD-CM, which is an American coding system, but it's the same for Australia and ICD-10, I just check that. And then if you go to the bottom of your note, it will insert itself in that note. Again, you can scroll through, you can remove ones that aren't relevant. You can click on the one that you've inserted at the bottom of your note. If you click on it, it will actually link you back to the point in your transcript or your base note where it's pulled that information from. So you know exactly what terminology it's using to make that inference. Another great thing we have with integrations is if your EHR is integrated with Heidi, we do offer for some of our EHR integrations, coding will also integrate back into the system. It's a work in progress, but it's something that's on our roadmap at the moment. So we've already started testing.
Thanks, Phoebe. And another one we have coming through is looking at Jane from using Heidi in an oncology setting for a virtual health clinic. So found that it struggles to pick up names of chemotherapy or treatment protocols, and wondering if there is any suggestions. I think that find and replace might be a really great one to show here, where if if you have yeah, I'll let you show that, Phoebe.
Yeah, so in Heidi's memory, this is where you can basically all your back end like wording and framing preferences. So in find and replace, you can see that I've got some in like instead of saying if I say NORAD in the session, I want it to say noradrenaline in my notes or yeah, any of those kind of abbreviations. Or if there's any like nuanced medical terminology that you know isn't being picked up, you can add it in here. And then similarly, well, not similarly, but in a similar vein with snippets, if you've got really common terminology and like text blocks that you always insert in your notes, and that could be like,
Like the treatment protocols is an example there they could use.
Yeah, treatment protocols or normative like head to toe assessments that you, if your patient's assess, if your patient's healthy, you can just insert those in automatically to your notes without having to type all that out.
And another little tip is you can also use context for this purpose. So if, for example, you are speaking about a specific chemotherapy, you can just like add insights in here and actually type the chemotherapy so it has that context and knows to generate that into your note.
Yeah, that's right. Um, Great. I've also seen a question around the multilingual function. I think it's a great opportunity. We've got still got some time. So with the multilingual function, as we said, before you start a session, you can choose up to 3 languages in the input, and that's really great if you know that you're going into a consult with a patient who may speak English, but their like mother is there who speaks Spanish, and you know there's lots of different languages being spoken in the same setting. That's amazing because we'll be able to pick all those languages up. Also, in like an emergency context, it's really great if you've got a patient you don't know what language they speak, you can just select auto detect. And for the output, as again, if your input language is English, but in this scenario, hypothetically, my patient's first language might be Mandarin, and his second language is English. For the patient explainer, I might want to translate that to Mandarin. So I know that and I just click yes, regenerate. And then he'll have that patient explainer written in his native language. Again, as Joss said, we're not a formal translation service. So if you're communicating important medical advice and clinical information to a patient, it's important that you also understand what's being given to your patient.
Another good one, sort of in that vein, is around the question is, do you ever have concerns regarding your own privacy as a clinician? So regarding Heidi recording your interactions with patients, and how is data stored and who can access it? So I think this is a really good one to call out because we take this really seriously. We have a very extensive legal and compliance team that have been with us from the very start to ensure the safety and privacy of everyone's data. So firstly, your data is stored locally in your jurisdiction. So you can be assured that all data is stored locally. You also have control around how long your data is stored for. So if you want to only have it for a day, you have the power to set that, or if you're in an organization, they will set that for you. So that is in the power of the user of Heidi as to how long the data is stored. So if you go, sorry, Phoebe, I've ruined here, but if you go to the settings, you can determine how your data is managed here and select automatically delete sessions, and then it will give you a prompt to determine how long you want your data to remain in Heidi for.
Yeah, great. We'll probably have time for a few more questions.
I've got one here, Phoebe. If I forget to document something in the moment, can I add details after the session ends?
Absolutely. So the way Heidi's built is, as we showed you before, you can go into context for all your pre-appointment planning. So before even the patient walks into the room, and then the transcription, obviously, you can that's while your patient's there and you're recording the conversation. And then after they've left, I can continue to upload and add any other information that I'm getting into this context section. And whatever documents I continue to create will keep syncing and updating with the information that's brought in. And you can also go back to documents that you've already, sorry, it's all in Chinese now, but if I go back to Joss's, so it's in English, it'll keep updating. So if you add anything into context, like family arrived, wife, I don't know, is asking about rehab referral. Sorry, it's my misspelling, but you'll see the update. I can then sync the changes, and that will take that context information. It will probably place it into my plan, into my like discharge planning. That was a bad example, but I think it showed that you can keep updating your notes progressively.
Right, another one. Can I use Heidi when like in noisy settings? So yeah, I think answer to that is yes. We've trialed it in many different environments. I think there's usually a surprise at how well it can pick up, even if you're, I've been in an environment where we have lots of different people speaking and just using Heidi one-to-one with someone where we had people immediately around us speaking quite loudly. And it no problem picked up exactly what we were speaking about. So we're finding the results of that is that it works really well in noisy settings. But of course, try it out. Let us know if you have any challenges, but we haven't had that really come up as an issue at all.
Yeah, and Joss has worked on quite a few implementations across some big tertiary hospitals, including Queensland Children's Health, and they've found really good results from their ward clinic staff and their medical staff doing medical rounds and things like that. So,
Yeah.
the other thing we'll show you is just on the note of audio and transcription, you've also got a telehealth option. So if you are a telehealth nurse or you know that you do a lot of e-consults, there's a telehealth option that you can pick. And then what you can do is you can sync the recording from whatever sort of telehealth platform you're using, if it's like Zoom or if it's Teams or if it's a bespoke clinical solution that your work is using, it'll pick all of that up through that program.
Great.
Okay, so Rebecca's got a great question. Do you think Heidi can be useful in hospitals that don't use an EMR, still everything on paper? I think Heidi would be great for that, Rebecca, because instead of having to write everything, just because you don't have an EMR and it's not integrated, it doesn't mean that you can't make use of the automated document generation. So if you guys are still all on paper, I'm guessing that you guys are still writing everything down. And as we showed you before, once you've got your notes that have been generated and all of your documents, you can print them off, you can export them as PDFs and Word documents, or you can send them as an email as well. So you can even just send them back to your work email. I feel like I was going to say something else, but yeah. Oh, actually, no, that's what I was going to say. Also, on the note of paper and forms, I know from experience as well, still working in the public healthcare system, there's a lot of forms that nurses have to fill out, whether it's in PACU and clinical assessment forms, falls risk assessments. It's kind of never ending. And Heidi, also in their template functionality, we have the ability to fill out a structured form, and that could be anything from like a government form or a hospital-based form and a PDF. And this is an example of a form that we've been able to fill out post a patient session. Just give me one moment. I'll just pull it up. And this is what Heidi was able to do from all the session information. So this is using the same example from Sarah and Tom, who had type 1 diabetes. I just uploaded this form directly to Heidi, and it was able to fill out all that information based on my patient session. And that will download automatically on my computer, and then I can just, yeah. And as you can see, it's pretty advanced in how it's check boxes and different different kind of formatting. So that's something that's really great, we think, for nursing, because again, we know how many forms nurses have to fill out. Okay, I think the questions are starting to slow down a bit. So we might start to wrap it up there. But yeah, look, thank you so much for joining. Thanks again, obviously, to Simon for jumping in and giving us all those really interesting insights. We really enjoy demoing the product for nurses because Joss and I are incredibly passionate about nursing, and it's really exciting that Heidi's starting to move into that space to support such an important and crucial workforce. As we said, we will send out an email with the recording and the deck as well. So yeah, thanks for joining and have a great rest of your day.
Thanks,
Vivian,
everyone.
Joss, that was so good. Thank you so much.
Thanks, Simon. Thanks,
See you.
everyone. Bye.